show, Dr. Katie. Thank you so much for being here.
Oh, it's my pleasure, Tansy, for having me. Thank you.
When I learned about you and the work that you do, I became very excited to talk about the conversation that we're going to talk about, which is all about oncology and also conscious oncology. I have a lot of history with this in my family and a lot of clients, friends, and family who have been struggling with this conversation. And I feel like this is going to be something that is going to really help open up some doors and some opportunities for people as they move forward.
I love that. Well, I'm excited to be here and have the conversation with you.
Yeah. So before we start off the show, I always love to allow my listeners to really dive into who you are and to allow them to see the depths of where you're at right now. So, is there a word or a phrase that you're really embodying in this season of your life?
Hmm, that's a good question. I would say, the one word that I am intentionally cultivating in my life right now is presence. All we have is the present moment and learning how to be present with all of the things, right? Even the uncomfortable things. And I'm in a, transition phase of my career, starting a new practice. And it's interesting to be, in this new phase. And I find myself sometimes getting busy, caught up in the busyness, but bringing myself back to be really present with what's happening in my life and also with the people in my life.
I feel that presence, the practice of presence, has always been important, but I feel like right now is critical. Do you see that too?
Well, I think there's so much happening in the world that it's
Yeah.
really easy to get distracted by all the things. And, life is moving faster. It feels like it just keeps getting faster and faster, and it gets easier to get pulled out of the present moment. And so, yes, I would say it's particularly important right now. And that's probably why also that I'm focused on that, is because I think that we're in a time where if you don't intentionally cultivate presence, it's easy to get pulled out.
Yeah. Well, thinking about that and thinking about your word, is there anything in particular self-care wise that you're doing to truly embody that?
Well, I think that my life as I am living it right now is all the way around focused on cultivating that, because as I'm building, I left a career in conventional oncology after practicing for 20 years, and I have three children and all the things. I ran a business outside of my practice as well. And so I had been so busy, and there's so much to do always, right? That when I stepped into this new chapter, I wanted to design my life in a way that I was living what I was going to teach other people. And so from the minute I wake up, I have routines, but then flexibility with my routines to, cultivate that. So I meditate each day. I make sure that I'm moving my body. I have, practices for the way that I'm eating and experiencing all of the parts of life that I think I was too busy to really appreciate before. And so my goal is to live that as, like, they say that masters don't meditate, their life is meditation, right? They're like living in meditation. And so I I'm definitely not there, but I'm like, I intentionally cultivate that in all the aspects of my life, because I've realized that if you don't intentionally do that, it slips away from you and you just end up in the doing and in the busyness.
Well, that's so interesting. Well, I wanna start diving into the concept of oncology because I feel like your word, presence, very much connects into this whole concept because when we talk about oncology, when we talk about cancer, there is definitely a stress piece that's involved. There's so many things, but being present is something that I think is probably an important piece in learning how to do that. So I've seen in my own life that oncology needs are becoming more and more prevalent these days with episodes of cancer diagnoses on the rise. Before we really dive into your story and how you've gotten to practice as the conscious oncologist, I'm curious if you have seen a rise in this as well. And why do you think that is?
Sure. Well, the statistics are showing that cancer rates are increasing, particularly in younger people. So, seeing an increase in colorectal cancer in younger people, as well as breast cancer as well in women. And, you know, there are questions. I think, a lot of people are um, making assumptions about what's causing that. And I can't say for sure, but what I can say is that as a society, we are getting sicker. So it's not just cancer that's increasing, diabetes, obesity, neurodegenerative diseases are all skyrocketing. And I think it has to do with our lifestyle. I really think that the lifestyle that we're living in industrialized society is not conducive to wellness and well-being, and that it requires a very intentional decision to be healthy. Because if you just do what is modeled by society of working harder, doing all the things, living the busy life, trying to meet the expectations of what's expected in society, it pulls us out of ourselves, both emotionally and from spiritually speaking, like who we are at our authentic core, and we start living in a way that is acceptable to society, but it's not really in alignment with who we are. And that makes us sick over time, right? So that's one piece of it. But then the other piece of it is the way that we're eating and drinking and not moving our bodies. Cancer is a metabolic condition, along with all those other chronic illnesses that I described. So diabetes, obesity, neurodegenerative, they all tie back to metabolic condition. And we are eating a lot of processed foods, probably eating too many carbohydrates and sugars that, cause chronic inflammation in our bodies. And, you know, the way that we, we're wanting to eat things fast, like get things that are convenient and simple. And I'm no fault to anyone, because this is just what we've been trained into. And also life is running at such a pace that it's hard to find whole foods and make them in a way that supports our body. And then also the foods that we're eating are contaminated. There's glyphosate in the soil, and it's just easy to grab something that's convenient, that's pre-made, but the truth is that that puts a lot of burden on our body to deal with that inflammation. And so I think it comes down to a lot of things. I think there are a lot of things. And then the other thing is that cancer and other chronic illnesses are also tied to emotional trauma and stress. And if you look at society, we are all emotionally traumatized just by living in today's society. You can use COVID as an example of like what we all experienced moving through the past few years was a collective trauma. And I think we're seeing the results of that. I think other people might say there's, a contributing factor with the turbo cancers of maybe, that's related to some of the things that happened during COVID as well. I don't know yet, it's hard to say, but I think there's a lot of factors. And I think cancer is not the only disease that's on the rise currently.
When you say, just for those who don't know exactly what this is, when you say that it is a metabolic condition, what exactly does that mean?
Sure. So the normal metabolism of our cells is done by the mitochondria. So the mitochondria are responsible for metabolizing nutrients that we bring into our body. And nutrients we think of as fats, proteins, or carbohydrates. And when we have healthy mitochondria, the mitochondria use those different nutrients to create energy or ATP in the cells. With cancer, all cancer cells end up switching from the normal metabolism that the mitochondria use, which is oxidative phosphorylation. They switch to something called anaerobic glycolysis or fermentation. So they basically stop using oxygen in the mitochondria to metabolize our nutrients, and they start using fermentation. And that process of fermentation can only use sugar. And basically, that's why people say sugar feeds cancer, is because cancer cells actually can only use glucose. That is the only fuel. I guess glutamine as well as another fuel source, but that's a fatty acid. So basically, sugar is the only nutrient that is used by cells that are doing anaerobic glycolysis or fermentation. And the other thing is that the reason why cells move from doing the normal way of metabolism to fermentation is because either the mitochondria aren't working properly, and this could be just due to erosion of the health of mitochondria that could be passed down. Actually, you could be born with mitochondria that are not functioning optimally just from your, family, what your ancestors have experienced, but it also has to do with the way that we're living. So our mitochondria need appropriate inputs to function properly. So this is proper nutrition with antioxidants, plants, connection with the sun, connection with the earth. So if we're not getting those inputs, then the mitochondria aren't functioning, and it can switch over to this anaerobic glycolysis. And the anaerobic glycolysis makes way less ATP than the normal oxidative phosphorylation with mitochondria. So just for an example, you have one molecule of glucose, it makes 9 times the amount of ATP when you do the normal respiration using your mitochondria. When it can't do that and it's using fermentation, it's making like 1/9 of the amount of energy. And this is why cancer cells start to pull all the sugar that they can. So if you look at the tests that we use to diagnose cancer, you might have heard of a PET scan. A PET scan is a radio-labeled sugar that is injected into the body. And that sugar is taken up by the cancer and shows up bright. Why does that happen? Because the tumor is pulling as much sugar as it can to itself because it's trying to make ATP just like all the other normal cells. But because it needs like 9 times the amount of sugar to create one ATP, it basically is pulling sugar from everywhere that it can. And so this is why, basically you'll hear people talking about starving cancer by, decreasing sugar intake and carbohydrates, is because the cancer can only use that. And this is, the Thomas Seyfried is from Boston University. He's a professor of biology who wrote the book Cancer as a Metabolic Condition. And I just actually had a conversation with him, and he was describing that cancer cells, in the literature, there is no evidence of cancer cells that have not made this transition from normal respiration of oxidative phosphorylation to fermentation or anaerobic glycolysis. And so by definition, this is what cancer cells do. And so it's this shift away from our normal metabolism that causes cancer cells. But the amazing part about that is that you can use diet and fasting to basically start to decrease the sugar that's going to the cancer and boost the mitochondrial function so that the normal cells can start to function properly and boost your immune system to can't put cancer basically to sleep, because basically you're starving those cells. So this is what I mean. And this is not specific to cancer, because all these other chronic conditions also tie to our mitochondrial health. And if we're not giving our bodies the proper inputs, we can't do what the bodies are designed to do. And so they start using these alternative mechanisms, which ultimately lead to disease in the body.
That's fascinating, and I love your explanation because it really shows the behind the scenes of what's going on. We hear about PET scans, we hear about starving cancer, we hear about all of these terms or these trigger phrases, but I think a lot of us don't know what that actually means and why that's so important. So thank you for explaining all of that out.
Yeah, and I think if people really want to learn about this on my podcast called Born to Heal, you can look for the episode with Thomas Seyfried, and that gives you all the science. It actually was so deep. I was like, I don't know if people can follow this because it was really scientifically like very deep. But if people want to hear that, he explains things so well and really understands the science that I think that that could be beneficial if people want to know more.
Well, let's put a pin in that conversation for just one moment because I want to dive into you and to ask you, can you share a bit of your story of why you became so passionate about the work that you're doing and the impact that is starting to bring to the world?
Sure. So I'm a radiation oncologist by training. So I did medical school and residency all at Duke University in North Carolina. And then I practiced radiation oncology for 20 years. And I also served as a healthcare leader. So I ran end to end cancer services for a large healthcare organization. And, was doing all the things and believed in actually the treatments that I was giving. I cared for probably 5,000 patients in my career. And, you know, in 2019, I started to sense that something wasn't right, but I couldn't put my finger on it. And I just sensed that maybe I wasn't supposed to be doing what I was doing, but it didn't make logical sense. And my husband at the time was like, what are you talking about? What do you mean? Like, you don't think that you should be practicing radiation oncology? You trained your whole life and I didn't have my first job until I was 32 because I was in training that whole time. It's such a long path to get there that he was like, you trained your whole life for this and you're good at your job, your colleagues love you, your patients love you. Why would you, and you make good money and you work 4 days a week? Like, what's wrong with you? Like, is there something wrong with you that you can't be happy with having all the things that someone else, like other people would die to have the life that you have? And so he, you know, made me start to question myself. Like I was like, oh gosh, you know what? He's kind of got some points there. I'm like, maybe there's something wrong with me. Maybe I'm just not happy. And so for about a year, I was kind of sitting with that and I was like, is it just me? Am I restless? What is this all about? And then in 2020, I had an experience that is called a shared death experience. And this is similar to a near death experience, but the difference is that the person who has the experience is not the person who dies. It's someone who is at the scene or connected with the person who transitions. And it often happens to healthcare professionals or emergency personnel who are at the scene when someone transitions. And the person who is there has a metaphysical experience that is quite similar to what people who've had near death experiences describe. And so that happened to me in the fall of 2020. And I experienced all the things like the love and the light and just the overwhelming beauty of whatever is beyond this that I have no words for, to be honest. It's like ineffable. It's indescribable with words. And I had that experience. And after that, I just knew I had to leave. So I had this inkling before, but after that event, I was like, I have to do something different. And the hard part was that I didn't know what it was. I just knew that what I was doing was not what I was meant to be doing. And so it took me a few years to unravel this because my husband was not supportive, which I just described before. And it makes sense to me from a like financial security standpoint. It's like, well, you're just gonna stop and like not work and like you don't know what you want to do. Like it just didn't, he just did not get it. And I said, yes. And I said, I intentionally did not want to just do another like training or something to go right into something else, because I knew I needed to create space to really figure out what this was all about. And so I wanted to quit and then take some time off to sit with what is it that I'm being called to do. So in 2022, I resigned from my position in radiation oncology, went through a bunch of transitions with that, basically went through a divorce, moved, all the things, and created space to figure out what was I supposed to do. And what I started doing was, right when this happened, in 2020, I started researching, okay, I know what traditional medicine and specifically radiation oncology is about, because that's how I've spent my whole career. And everything that I was taught was to look at healing through the lens of pathology. Like when something's wrong, what do you do to fix it? And specifically, it was looking at medicines or radiation in my particular, specialty. It was very much focused on pathology. And so I knew that very well. But what I decided was, I was like, well, I don't know what it looks like to have a perfectly functioning body. Like maybe that's what I need to study. So I really dove into what creates health, because I knew so much about disease that I was like, this is what I don't know about. And maybe that's where the answers lie. And so I spent is basically like 3 years really looking into what makes the body healthy? What are the components to create true well-being in the body? And what I learned was that all healing really requires four aspects. So the physical aspect, which we all think about, this is like the diet and, the things that you're doing, the external, supplements or whatever you're doing to the body. But the other components were emotional, mental, and spiritual components. Any path back to wholeness really required all four of those things. And, I started to learn things that I was never taught in medical school. Like, for example, this whole thing about cancer as a metabolic condition, I was never taught that. And this is shocking for most people, but most doctors have no education in nutrition. In my education, I had zero, like I did not have one course on nutrition. And still to this day, most medical schools do not teach nutrition. And so most doctors just don't have that knowledge. But as I started to see the data around cancer as a metabolic condition, I was like, wow, this is so shocking to me that I didn't know this, right? And then learning about the mitochondria and the functioning of the cells and the function of the body, and also like the importance of connecting with the nature. So the sun, like we're taught to tell everyone to wear sunscreen and stay out of the sun, but actually we should be getting into the sun every day and grounding with the earth and just all these things that I just was not taught, right? And then the other piece was the emotional component. We're not taught anything about emotions in Western medicine. And as I started to look into like the ACE study, which for your listeners, if they're not familiar with the ACE study, that stands for Adverse Childhood Events. And this is a very large study that looked at children who experienced emotional trauma as children. So it could be divorce of a parent, it could be sexual abuse, it could be physical abuse, could be neglect, could be a parent with an addiction or incarceration. There's a whole list of them. But basically what they found was that the higher the number of these adverse childhood events for the children, the higher the incidence of cancer, cardiovascular disease, lung disease, diabetes. This is like a clear correlation between emotional trauma and illness later in life. And that to me was also like something I was never taught about. And so as I started looking at all of this, I realized that, you know, healing really has to have this holistic approach to create wellness in the body. And so I started my integrative oncology practice based out of that. But the one thing that really still I didn't understand was why. Like, why do we need these other components? And on the surface level, you're like, okay, well, it makes sense because we're emotional beings, and, there's the mental body and the spiritual body. So someone who is, listening to your podcast understands that we are not just a physical body, we are all of these other components. So it makes sense. But from a scientific perspective, I didn't have any science to say why. And it wasn't until recently that I came across the work of Gerald Pollack, who studies the fourth phase of water, that I started to understand that there is science that explains why you need physical, emotional, mental, and spiritual components to a regimen to create health in the body. And so I'll stop there because we can get into that, but it's like deep science. But as I dove into the science of water and the fourth phase of water, it helped me understand that this is not just, like people might say, like woo woo or whatever. It's like, no, no, no. This is based and rooted in science, in the way that our bodies work, because our bodies are 70% volume of 70% water by volume. But if you look at the molecules in our body, 99.9% of the molecules in our body are water. So we are like walking bodies of water. And so it makes sense that when we get the water right in our body, and this is not just about drinking the water, and I can get into that, it's not just about the water that you drink, it's the water that you hold in your cells and in your body. This is the science that explains why we need these different components as part of a holistic healing practice.
I want to go back to one thing you said, and this is more towards the beginning of this conversation. You said that with your shared NDE, that that you knew after that event, you knew that something needed to change. What was that thing? Before we go further, I'm curious what that thing was. What changed it for you? What did you notice?
Well, I just had like a knowing inside me. Before, remember in 2019, I had this like intuition that something wasn't right and that I wasn't doing what I was meant to be doing, but I couldn't, it wasn't like a conviction. It wasn't like I knew I needed to do that. I was just sensing that. But after that event, it was just like I knew, like I was just like clear, this is not right. It was almost like, so one of the things that I've learned since I had this experience is that when people experience NDEs, which this I would say is similar, although, different, but from a consciousness standpoint is similar, is that they are bathed with very high frequencies. And so this notion comes from the work of David Hawkins, who studied consciousness. He was a physician who studied consciousness, and he has basically, the Power versus Force is one of his most popular books, but he talks about how our emotions are tied to frequency, and that illness is created at low frequency emotions and well-being is created in the range of like love, peace, and joy, kind of high frequency emotions. But he talks about in Power versus Force that people who have NDEs are just bathed in this very high frequencies, and that changes them. And it's almost like it tunes your antenna. And that's really what happened after that, was that like my antenna was just like tuned, and like I couldn't tell you why something was true or not. I could just sense, like all of a sudden something would resonate, and I'm like, that's true and this is not. And so the only thing that I can say about this is that I started to become clear about what wasn't true for me and what wasn't resonating with me. And I would just follow. Like, so I was just like this little antenna that was following what was resonating with me. And that's really what happened with that event. But the other thing that I think is important to mention in that comes from my career is I've spent a lot of time around death. So I've cared for over 5,000 people with cancer. Almost half of my practice was palliative. So I've been around a lot of people who have transitioned. And I had this experience in 2019. So 2019, I helped a patient transition using at the time it was called Death with Dignity. Now it's called Medical Aid in Dying, but it's basically where if someone has a terminal illness, they can take a medication to end their life on their terms so that they don't have suffering that, basically impacts their dignity and their control at the end of life. And so I had said when I decided to participate in that program that if I ever had a patient who wanted to use this medication, that I would offer to be there with them. Doctors, that's not required. Like doctors can just write the prescription and they don't have to be there with the patient. But I felt like if I was going to do that, that I wanted to offer that to my patients. So in 2019, I helped a patient transition, and it was the most beautiful transition I've ever experienced. It was with her and her daughter, and it was truly like a beautiful death, like a gift to her daughter for the way that all of that went, and also for her. But I remember when I came home from that, I said to my husband, I was like, when we leave alone. And I can't live my life according to anyone else's values, because when I leave here and I face whatever's next, and at that time, I didn't know what was next, but I was like, I'm doing that alone. So I cannot blame anyone else and be peer pressured into living my life in a way that is not true to myself, because when I leave, I'm going to be accountable to myself and only myself. And I also had been with so many other people that had died that I knew what people said when they got to the end of their life. They were like, I wish I had just listened to who I was. I wish I hadn't done what everyone else was telling me to do. I'd heard that from so many people that I knew that. And then this experience and all of that I brought into this shared death experience, so that when then I had this conviction of what was true for me, I knew I had to follow it, so it kind of all informed my actions after that event.
That is so beautiful. And it really shows the depth of how much you care about what you do, and also the dignity behind all of it, the dignity behind the transitioning. There's so much beauty in that part of our lives that so many of us push away, but you really embrace that.
Yeah. Well, and my entry into medicine was actually around death. So I was a neuroscience biopsychology major as an undergrad, and I naively was like, what can I do with that? And I was like, oh, I could do medicine or research. You can do anything with an undergraduate degree, but at the time I wasn't thinking that way. And my mom was like, I don't think you want to be a doctor. Like, you love kids, you want to have a family. She was a nurse practitioner and she worked with a lot of doctors in the ER. And she was just like, I don't know. She's like, Katie, I really think you should think about this. And so I was like, well, what is the one thing that might help me cross medicine off my list? And I, at the time, had not known anyone who had died, except for I had a friend when I was in fourth grade who had died of leukemia. But other than that, I had never really been around death. And actually, I think that event was scary for me as like a, fourth grader. To have your friend die is just not something that you even have context for. So I said, well, why don't I just go volunteer for hospice? Because I don't think that I can handle people dying. And that way I can just cross medicine off my list. And I mean, as you can imagine, that story did not turn out the way that I had expected. And I volunteered at hospice and it changed my life. I was 20 years old at the time, and you're so self-absorbed, so self-focused. And I got in there, and spending time around people who were facing the end of their life was just mind blowing for me, because they shared things that I had never heard from anyone else. Like what was important in life, what they would have done differently, what they wish they had done more of. And I loved that. And I loved the intimacy, even though I was just like a volunteer, but these people were so open and so willing to share their wisdom in their last, days, months of life. And so through that experience, I knew I wanted to be around those people. Like I wanted to be with people when they were up against that wall, and that life became so real, because I learned so much in that space. And there was such intimacy that I figured gosh, if I'm having such intimate interactions with people as a volunteer, what would that be like if I was a doctor? And so I went into medical school specifically knowing I wanted to be an oncologist, but not knowing whether it be in, chemotherapy as a medical oncologist or radiation or surgery. But I went in knowing that I wanted to be an oncologist because of this, the realness and the intimacy that can be experienced in this space.
I feel like when people get to that end where that realness and that intimacy really comes in and they start to express those emotions, that feels to me like they are opening up to this concept of conscious oncology. But it feels like we could do something deeper prior to just those last days or those last weeks. So, could you elaborate on maybe how conscious oncology can help to bridge this gap between modern science and ancient wisdom so that people can use this in more of a healing aspect rather than just on the very last expressions of what they want to express in this life form?
Yeah. Well, actually, I think that any crisis has the opportunity to open people, and death is, basically a crisis, right? That cracks them open. And for sure, what you just described is as people get closer to that door, they start to open, and their antenna, again, like the same thing is you start to have kind of cracks in this facade or veil or whatever we want to call it, and they start to have awarenesses. But any crisis in our lives has the opportunity to open us. And crisis in Chinese is symbolized by two symbols. The first symbol is danger, which makes sense, but the second symbol is opportunity. And so in any crisis, there is opportunity for opening to something new. And so cancer is a crisis, but also so is divorce, so is losing your job, so is having a parent, losing a parent. All these things are crises. And I think it's what you do with that opportunity. Do you use it? And this was one of the things that I was doing with my patients long before I started this practice. I would always explain to them, look, it's hard to make changes, like big radical changes in your life when everything's going well, because the people around you are like, why are you doing this? Why are you shaking up a good thing? Like, if everything's going well, it's actually really hard to make those radical shifts. But when someone has cancer, I would tell them, look, like, if you make radical changes right now, if you say, like, I want to leave my job, I was just diagnosed with cancer, and this has like totally changed the way I see everything, no one questions that. Or if they do, it's much less than if everything was going well. And so I always encourage people to look at whatever crisis they're going through for the opportunities to make the changes that they already wanted to make. Like, kind of like with me, where I had that inclination. A lot of people have this where they like know something's off, but they don't know the answer. And in today's society, it's like if you don't know the answer, well, then you can't do something different. Well, the truth is sometimes you just know what's not right. And so a crisis can allow that opening for you to step through and do something different, even if it's just saying, you know what, this isn't working for me and I need to do something different and I need a little time to figure it out. But we value as a society knowing, and like, and especially for me as a doctor who like trained till I was 32, it's like this idea of just like not knowing what you're going to do sounds ludicrous. But it's like, it's following that. And so I love that you bring that up. It's like, how do we roll it back? How do we make these changes earlier so that you're not like most of my patients when they got to the end of the life and then regretting? And that's actually why I really made the changes that I did, because I knew, if as painful as it was to go through everything that I went through, I was not going to be, and it's funny because this like brings up emotion, but I was like, I am not going to get to the end of my life and regret that I didn't listen to that voice that I knew. I knew I needed to do something different, and I decided not to listen. I knew I couldn't do that.
Yeah, and oh, it gets so emotional when you finally connect into your heart and to the depth of that emotion of what you can't be anymore, and also what you know truly. that you have to move forward to truly be happy. Yeah,
Absolutely.
yeah. Well, thinking about the multiple root systems of cancer and how we discussed earlier about cancer being on this rise, why is it crucial to really start to address all of these aspects for a comprehensive healing?
Yeah. Well, so this comes back to the water. So basically, I'm going to describe a little bit of Gerald Pollack's work so people can understand this, and then I can explain how health is created in the body. But basically, Gerald Pollack's work is all about the fourth phase of water. And most of us, know that water exists in three phases. So liquid, which is water that we think of, solid, which is ice, and then steam, which is a vapor. But what Gerald Pollack showed was that water actually exists in a fourth phase, which is a crystalline-like phase. And basically, the study that he did was that he took a beaker of water and suspended a test tube in the water horizontally. So it's just like imagine, and actually it's open on both sides. So it's just like a tube that's just sitting in the water and they suspended it in there. And what they found was that the water started moving through this tube in one direction, and they were like, how is that happening? There's no like energy source like into this water. Why is that happening? And then they took the beaker of water and they put it in a lead box. And when they put it in a lead box, the water stopped moving. And what he found was basically what was happening is along this tube in the water was forming a crystalline like layer. It's almost like a jello, like I don't know how thick, like micrometers, like thick. It was a very thin layer, but basically creating this layer of a different structure of water that was negatively charged. And basically, it was just organizing the water in a different way along the tube. And then because of the charge differential that this water, when it crystallizes like this, it has a negative charge, but regular bulk water just has a positive charge. So this charge differential was moving the water through that tube. And the reason why it moves when you're just out, but stops moving in a lead box is because the source for creating this layer of structured water is infrared. Basically, we're surrounded by infrared, but also the most powerful source of infrared is the sun. Okay. And so I learned about Gerald Pollack's work through Tom Cowan, who's a medical doctor, Dr. Tom Cowan. He has a book called Cosmic Heart or Human Heart, Cosmic Heart. And what happened was is that I came upon this by accident, but obviously not accident. This is all synchronicity, right? Occurring, like happening. But basically what happened was started dating a guy who was a professional cyclist, and he had stopped cycling, before I met him, but basically he is very fit, like the fittest person I've ever met. But he has heart failure. And he explained that his heart failure came on when he was 50 years old, and he basically had been racing, and a month before he was diagnosed he had won like the Georgia state championships for not only masters, which he was a master, he was 50, but also for the pro category. And and then he said a month later his physician had sent him for an echocardiogram because his EKG, he had always had an arrhythmia, but it had been like changed a little. So she sent him for an echocardiogram. We went in for the echocardiogram, and basically the technician, while she was doing the scan, turned completely white, walked out of the room, and the next thing he knew, he was like, put into a defibrillating vest and told that his ejection fraction, which is a value of your heart function, was 15%, which 15% for your listeners, an ejection fraction of 15%, I knew as a doctor, is like something that person can barely get out of bed and walk to the front door, let alone to the mailbox. So I'm like, how in the heck can someone have an ejection fraction of 15% and not only riding a bike, but winning in professional categories at age 50 years old? I was like completely made zero sense to me from a physiologic function of like understanding how the heart works. And so I came across Tom Cowan through like just, I was watching, I was kind of doing my like research, all these different things. And I saw that he had this book called Human Heart, Cosmic Heart. And the first thing on the front of the book, it says, the heart is not a pump. And I was like, I got to read this because maybe this explains Steve. And so, what the book explains is that the circulation of the blood actually is not forced like the heart as a pump. It actually is related to the fourth phase of water. And that the vessels, just like that tube that was in that beaker of water, is basically a hydrophilic surface. And basically, hydrophilic just means water loving surface. And on any water loving surface, when you have the right inputs, one of them is infrared. There are a lot of other ones that I can talk about after this, but basically, when you have the right inputs, the water in the vessels structures along the vessels, and this creates the charge that moves the blood from the heart to the aorta, then to the small arteries, to the capillaries and the tissues where basically oxygen is offloaded and things that need to be removed are taken out into the blood, and then it circulates back up into the heart. And this makes sense because if you think about if the heart was really a pump, what happens with the blood is that if the pump is like, at the top and then it goes down and it basically stops in the capillary, the blood stops to offload the oxygen and you remove the waste, how does it get going again, right? If and also the blood cells are the same size as these capillaries. So like the sheer force, you'd have like shearing of the blood vessels. And so anyway, and then what he described was that what the heart is actually doing rather than pumping the blood like we think is actually vortexing it. And when I read this book, I was like blown away that I was like, how did I not know this? How did I never heard about this? And then Tom Cowan also has, so it's funny because I found the book because of this, like, clinical, like just confusing picture in front of me of this man. I was like, you make no sense to me from a physiologic standpoint. So I found his first book, the Human Heart, Cosmic Heart. But then what I found was that Tom had a book about cancer. And what he describes in the book about cancer is that not only does the fourth phase of water affect the circulation of the blood through the body, but it also affects this health of our tissues and organs in our body. And that a healthy organism, most of the water that we hold in our cells, remember I described that we're 99.9% water by molecules, that most of the water that we hold in our tissues is structured water when we're healthy. And that, remember, we talked about the metabolism, that the structuring of the water is tied to ATP production. Remember how I talked about when you have cancer, you basically aren't producing as much ATP because the fermentation process is so much less efficient. But basically, in order to structure the water in your cells, you need adequate supply of ATP because ATP causes like a conformational change of the proteins in your cells to structure the water. So in a healthy organism that has healthy mitochondria, most of the water that we hold in our cells is structured. And the things that help us structure the water in our cells are sunlight, right? The infrared, grounding to the earth. So putting our feet, connecting with nature, the food that we eat, because the food affects the mitochondria. And just this picture of the water all of a sudden started connecting all the dots. And then the other piece is that there's a lot of studies about how emotions affect the water. So Emoto was a Japanese scientist who studied the effect of words and emotions on the structure of water. And basically, the studies were, you would say loving things to water, and the water would have this, he would freeze it and basically would show these beautiful crystalline snowflake like structures if you said like I love you, or loving words to the water. But then if he said hateful things to the water or played Metallica, like heavy metal music or something, then you would see this really disorganized water when he froze it. And so we know that emotions affect the water that we hold in our cells. So I was like, oh, oh my gosh, like this makes sense to me, right? And then the other thing is our thoughts and consciousness also affect the water because water has memory. And this brought me to the work of Veda Austin. And Veda Austin is a water scientist as well as artist. And you can find her on Instagram. She has beautiful water crystallography, but basically she shows that water holds memory. And I'll just give an example just so that you can understand this. But she had a woman who was pregnant and about to have an ultrasound of her baby take a sip of water, think about her baby when she was sipping the water, and then Veda froze the water to do crystallography. And basically, on her Instagram, you can see this. It shows a photo of the crystallography of the water next to the photo of her ultrasound. And basically, they're both the same. You can see a picture of the fetus in the water. And so this is the science for me that brings it all together. So if you can understand what are the things that help us structure the water in our body, it explains why we need physical practices, like what we intake into our body as nutrition and also connecting with our environment. Also, the other thing is animals. So animals are infrared. Other people have infrared. This is why laying on of hands is healing because basically you're impacting the water, or why having a pet close by is healing, touching them. This is infrared that's affecting our water. So when I understood this, it just opened so much for me. And I think it's beautiful because there's science that explains it. And then it becomes simple if we understand the inputs that are going to help us structure the water in our cells, then we can become healthy. And I think it's important to mention to people it's not just about drinking structured water, because even if you drink water that's not structured, our bodies know how to structure it if we give it the proper inputs.
My frequency is skyrocketing right now. I'm so excited by this conversation that you just explained because it makes so much sense. I feel like, in very simplistic terms, so many of us are told, going back to that very first statement, that the heart does all the pumping, that that is the basis of it all. And I also see on social media, in podcasts, in blogs, all these talks of all these healthy, holistic things that we should be doing, grounding, getting out in the sun, breath work, all of these things. But what is so fascinating to me of what you just talked about is you have put a cycle and an understanding of why and what the reality is, right? And like just tied everything together. It all makes complete sense. And it all makes complete sense of some of those concepts that are seemingly so, as they say, woo woo, like affirmational work or the words that we speak, healing your emotions, all of that stuff. What it really comes down to is that on a root level, you are feeding your body with everything that you do and say.
Absolutely.
Yeah. Wow.
Yeah. Well, and I think for me too, one of the things that I experienced and then also I see with people who are looking into alternative or, healing methods outside of Western medicine is it is so confusing. I am confused and I have a lot of scientific knowledge to be able to look through things and understand how things work. But this simplified it for me because it makes sense. You're just like, okay, now I have a lens through which to filter all this stuff through. And I can, if I understand how this affects our water, then I can start to understand. And also, it starts to just make it simpler. Like the noise, it starts to cut out the noise. And that is really what I want to do for people. It's less about like, I have all the answers. I don't have all the answers. If there's one thing for sure that I know is like, I don't know what's true. Like, I'm learning myself. I'm just, honestly, the more that I know, the more I realize like there's so much that I don't know. But it's like making it simple for people to say, okay, these are the basic foundations of healing. And if you start to do these things, and the other thing that I'll say about this is that I didn't realize it, but I had started doing a lot of the things to get my water right before I knew that what I was doing was getting my water right. And it's it's been helping me get clearer. So I'm a clearer channel for higher levels of consciousness, right? So that near death or share death experience helped tune my antenna. But then as I cleared my body out, I'm more able to resonate with things that are true versus not. And I think this is one of the things that for people, if these practices are not just about healing cancer or other illness. If people are wanting to wake up and become more conscious, doing these practices are a way of cleaning yourself out. And if we're bodies of water, it's a balance of getting the right nourishment and detoxifying the crap that's inside us just from living in today's society. And like you said, there's emotional crap, there's mental crap, there's, in our food. So it's like, it's a balance. And when you start to understand that, oh, like I'm just cleaning my water. I'm just cleaning my water. And I had been doing that for a couple of years. And then now I'm like, okay, now I understand what I was doing. I didn't know that that's what it was, but it's like, it starts to become simpler. And the cleaner you get, the more you're able to tune to information.
Cleaning your water. I love that. So, thinking about that concept that we are comprised of so much water content, can you tell us the importance of not just killing cancer cells, but also digging into the emotional roots and the traumas as part of the healing process? Can you connect that piece of it in the concept of water?
Yeah. So basically in our water, it has structure and it also is influenced by vibration, right? And emotions hold vibration. There are studies that show actually people who cure their own illness. So Kelly Turner is a PhD who studied radical remissions, and she has a book called Radical Remissions and a second one called Radical Hope and a documentary called Radical Remission. And basically in there, she basically studied a lot of people who cured themselves of cancer without conventional treatment. And she compiled a list. Initially, it was 9, now it's 10 factors that people do in common. So, like all the people that she found that cured their illness did these 10 things. It's not causation. So, we don't know that these are the things that cause them to cure their cancer. But two of the things are related to emotions. One of them is releasing trapped emotions or healing past emotional trauma. And then the second one is facilitating um, positive emotions and teaching people how to move out of negative emotional states. And so there's, both from the ACE study that we know that, emotional trauma can cause cancer. And then this studies of looking at people who actually cured their illness without conventional treatment, doing this work, there's clearly a connection. And so for me, part of my practice is when someone comes to me is looking at the story of like what happened before you got sick, like what are the things that you've experienced, and then doing work to release that. And one of the things I think people think when they talk about this is an area that gets tricky because people think then you're saying, oh, you know like a common reaction would be like, oh, I have cancer. And now you're telling me that I caused it because I'm like, not managing my emotions. And I'm like, no, 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 please do not take it that way. Absolutely not, because we all are experience emotional trauma. Like we talked about, like the world that we live in is traumatizing. Turn on the news, it's like fear, nothing but fear, that's projected. But basically it's a consequence of living in today's world is that we all have things that either have happened to us in the past or have not learned how to process our emotions in a way that is really healthy, right? We create coping mechanisms that allow us to um, survive and basically, keep going in our life, but they may not be necessarily like healthy ways. And so Psych K is a technique that works on the subconscious to help people release those past traumas. And that I like that technique because it's just easy and simple and it doesn't re-traumatize people by doing a lot of talk therapy, and then also helps reprogram their mind for how to think about their past, recontextualize things, and then teaches them how to process emotions with using both sides of their brain. Because one of the things that happens with emotions is that, and this is like, I'm going to stereotype here, but it doesn't go down this way, but it's easy to think about it this way. So women tend to go into their right brain when they get emotional, and then they get like they can get overly emotional and feel like they're going to lose control. And men tend to become analytical and basically suppress the emotions and just like basically dismiss it. And what Psych K does is that through positioning of the body, it connects both sides of the brain through the corpus callosum. And when you teach people how to experience emotions with both sides of the brain activated, it becomes much easier to process emotions. And we are emotional beings. We are designed to have emotions. And so teaching people emotional fluency through a technique like this can be very powerful by both releasing the past emotions, but then teaching them how to experience their emotions and feel them without getting, worried they're going to get carried away and, like a puddle on the floor, or just like dismissing them by becoming overly analytical.
Y- Thinking about these words and thinking about what you just talked about, I would think that emotions and wounds can really get triggered during the experience of going through the healing process of cancer, the treatment process.
It's
Can you
traumatizing.
yeah, can you give us a little sneak peek into maybe how words play a role in the cancer journey and what we need to know? I know you had a TED Talk about this, correct?
Yeah.
Yeah. Can we talk a little bit about that and maybe what health professionals and others who are this could be family and friends as well, helping cancer patients go through this process, what they need to know and what the patient themselves need to know?
Sure. So my TEDx talk is called "How to Talk to Someone with Cancer," and this started by accident or maybe synchronistically, I don't know. But basically what happened was I was a healthcare leader and I was designing the like cancer service line. So looking at end-to-end cancer care. And my belief is whenever you're designing any kind of program, you need to have the people who are experiencing the care at the table. And so I had a panel of patient advisors. And one day we were having a conversation about the program called survivorship, which is basically when someone finishes active cancer treatment, they go into a program called survivorship, which is basically you're done with treatment and now we're just going to help you manage the side effects of the treatment to kind of get back to life. And so one of my patient advisors said, I hate that word. And I literally was like looking around. I'm like, wait, I'm the only one talking. I'm like, what word do you not like? I was so confused. And she's like, survivor. And then she went on to explain she had stage 4 breast cancer. And she said, that word, I don't know why you use that word to describe me, because I'm not going to survive my cancer. I'm going to die of my cancer. And you call me a survivor. And this program that you're talking about, I will never get access to because I'm never going to be done with treatment. I'm never going to finish and go into survivorship. And then slowly the other people around the table started speaking up and saying, you know what, I have never liked that word either, but I have a different reason. Like one person had like early stage cancer and they were like, I feel like I didn't earn the term. Like, I don't feel like I really survived. And it was so interesting. And I just had never thought about the word. It was a word that I had used for a decade, at least at that point, and I had no idea that this word might be causing trauma to people and might be negatively impacting people. And so I ended up collaborating with colleagues around the country, and we did a couple studies. But the one that was the published study was done through Susan Love's Army of Women, and we studied 1,400 women with breast cancer, asking them how they felt about the term survivor. Which other studies had done this before, and most of the studies had said people are like neutral to maybe slightly positive about the term survivor. But in our study, we asked them how they felt, but we also asked them why. And in the why data is where we got all of the information, because we found that it was kind of neutral. People kind of said they're like, I don't know, it's fine one way or the other. But then when you looked at the comments of why people felt the way that they did, 60% of the comments were negative, and they reflected the things that we heard. Like, I'm angry that the lie of survivorship is perpetrated upon me because I have stage 4 cancer. Or someone else would say, you know, I feel like I'm tempting fate when I say I'm a survivor, like it's going to come back, or I didn't deserve that, or it's like it's a reminder of a terrible time in my life. And the study just opened my eyes. I never used the word survivor again after that, and I was just really focused on language because I realized that language can have such a powerful impact on the way people experience their illness. And I started to look around the language that we're using in oncology specifically, and battle language is like the, front and center. Like everybody uses battle language when they're talking about cancer. It's like we're going to win the fight and the war against cancer, and it's like winning the battle or losing the battle, all of these things. And as I dove into the literature, I started to realize that this is really problematic. And battle language, it makes sense why, like, Nixon first launched the war on cancer, is because politicians are trying to sell something, right? And it evokes emotion. And also, like in marketing, you'll see nonprofits, they use all this battle language because they're trying to raise money. So they're trying to, like, really pull on people's heartstrings. But it makes sense in those settings like marketing or politics, but it doesn't make sense in the healing setting. Like when we want people to heal, we don't want to like evoke negative emotions and fear and all of that. And so for me, that's what my TED Talk really starts out talking about survivorship, but then it talks also about the battle language and the physiologic effect of battle language on our body. And my ultimate takeaway is like, a lot of people ask me, well, then what do you use instead of survivor? What's the label that you use? Do you use warrior? Do you use thriver? And I was like, okay, one thing that I've learned from all of this is that I'm not using one label to talk about a whole heterogeneous large group of people. Cancer is like, probably like 100 different diseases actually, right? And then it's like millions of people. Like, why would I ever think that one label is a good idea for all those people? So for me, it's like, it's just made me curious, and now I don't use labels for people, and I encourage people who are going through cancer or people who are supporting someone with cancer to get curious and start to ask the questions like, what language feels supportive for you? Because for someone, they may like that. It may like mobilize them. They're like, I'm in this battle, and what, fine. I'm like, if that works for you, if that's like, I all for that. But the problem is that we don't ask, and then we're just using things. And I think the biggest risk for just people to think about is when you use this battle language and you're talking to someone that you love and say you're like in the fight, blah, 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 let's battle this. And that person's like, you know what? I just don't really want to do all that. It can be really hard because then now they feel responsible for making you feel better because they don't want to do what you want to do. And so it's really just starting to become aware that we may say things just because we don't know what to say. And it's okay to say, I don't know what to say. Like, I don't know what would be supportive to you. So, help me out. Like, how can I best support you? What are the words that I can use? Is there a way that you want to talk about healing? And so I think that that's my biggest takeaway, is just being curious and start to ask the questions and recognize the importance of language in helping facilitate healing in the body.
And that's beautiful because every single one of us sees words or ways of being with certain perspectives. And one person may look at the battle language as, like you said, motivating, and others may look at it as something negative and defeating. So that's that's pretty fascinating.
Yeah, and I think that it just ties into this idea of whenever you're supporting someone, well, whenever we're healing ourselves, we want to recognize that everything that we do, including the words that we use, impact our body, and being intentional about that. But then the other thing is when we're supporting other people is recognizing that our perspectives are likely different than the person who is sick, and kind of checking ourselves and just recognizing what we're bringing into those dynamics, and is it supportive for that other person? Because ultimately what we want the people that we love to feel is that we love them and that we support them, and just recognizing that we being aware of the words that we're using can facilitate expression of that love, but it also can create a little bit of a divide and make people feel disconnected.
Yeah. Your holistic approach is a fascinating, and I see that you span anywhere from prevention all the way to post-treatment recovery and really honor all those phases. How can individuals proactively start to integrate conscious practices into their daily lives to either prevent the onset of cancer, but also then to maybe help navigate it a little bit more smoothly? And how does this differ from traditional medicine or traditional preventative measures?
Yeah, well, I think that, you know, that's a good question. How does it differ from traditional preventive measures? But I think in when we hear, I'm going to start with the last part first. So, in traditional Western medicine, and we talk about cancer, we talk about it as a genetic condition, and that basically, it's usually caused by DNA mutations. But the truth is that clinically, that's not what we see. So my specialty was breast cancer when I was practicing. And with breast cancer, only 5 to 10% of breast cancers are genetically related. 90% are what we call sporadic, which means we just don't know what caused them. And so that's not correct. You know what I'm saying? If 90% of the time it doesn't fit what we've been taught, I'm like, that just doesn't work, right? So it's like the premise is faulty there with what causes cancer, because people say, well, it's not in my family, so I'm probably fine. And then they get cancer and they're like, what happened? And I'm like, well, yeah, like 90% of the time you don't have a family history, right? So it's like we've been told this story that's just not correct on a foundational level. But prevention is getting back to ourselves and getting connected with our natural environment. And then also the other thing to recognize here is that like EMFs and cell phones and all those things also negatively influence our water. So connecting with nature, eating whole foods, connecting with other loving individuals, doing the emotional work to help ourselves get more fluent with our own emotions. These are some basic things that we can just start to do right now. Like you can go spend time in the sunshine today. You can go put your feet in the earth. You can, um, you know, uh, eat vegetables that basically are structured water, bringing them into your body. So there's so many things that we can do. It's really basic. And a lot of the stuff in preventive medicine, they talk about that from a lifestyle standpoint. But what they don't explain is that doing these things, like, and really incorporating them into your life requires you to think differently than we've been taught to think in society. And it requires people to change the way that they're living, which I understand is painful because we're all about convenience and doing things fast and disconnect. We don't have time to get, put our feet in the soil or whatever it is. But if you can't, then okay, like get a PEMF mat or get an earthing, mat for your bed or whatever it is. But we just need to start to become conscious that we are designed to have inputs from our natural environment to our body. This is how our bodies are designed to be healthy. And that when we're in the busy rushing and doing all the things, we're losing that connection, and that ultimately is going to influence our health. And so it requires a little bit of rejecting what we've been told by society and Western medicine, and starting to prioritize, really looking at what it means to be healthy and eating real foods and getting the inputs that we need.
You know, you talking about all these preventative measures and things that people can do while they're on their healing journey, cleaning up their water. I'm curious because this is emphasized so much. I'm curious that in cancer care, how can people be successful in the sense of like, what should they be looking at when it comes to traditional medical markers? And what indicators maybe point to more holistic and profound healing experiences? Like what are some markers for success that people can look at to stay positive, to stay focused, to stay moving forward? And then, how can they use that?
Well, so I think that, this is one of and I didn't start here. So I will say that I launched my practice just recently in October. We're recording this in February. So what is that? November, December, January, February, 4 months ago. Okay. When I started my practice, I was really thinking that it would be helping people with conventional treatment, but, doing these holistic things to help them get better results. But one of the things that I'm realizing is that cancer, healing cancer requires a couple things. One is that we want to make our immune system work better and we want to eliminate toxins. Well, when you get chemotherapy and you get radiation, what are you doing? You're back basically doing the exact opposite. You're decreasing your immune system and you're increasing the toxicity in your body. And so I started my practice with helping a lot of people through conventional treatment. And I realized that the conventional treatment was eroding some of these things that actually build health. And I'm not saying that people shouldn't get conventional treatment. I'm just saying that you're going to need to work harder. So you're really going to need to incorporate these things if you're doing conventional treatment. And then when you finish, really then finding someone who can help you create a plan that's simple and actionable for yourself to incorporate these things to detoxify your body and then also build up your immune system and start to get the water in your cells right. But when you're going through chemotherapy, it basically is chemotherapy or radiation, it's affecting our water in a negative way. And so I started out with this one idea and then realizing, oh my goodness, like this goes even further than I thought it did, that, the treatments that we're giving maybe, are harming this concept temporarily. The thing is that people definitely can get back there, but this is part of the reason why I was frustrated, I think, in 2019 before my event. I'll tell you like just a quick story. I heard this parable at a meditation retreat, parable of the river. And in the parable, they talk about a village that's alongside the river. And the villagers one day see a person drowning in the river. And so, someone rushes out and saves them. And then the next day, there are two people drowning in the river. So then they, send two people out and they get them. And then every day it's like doubling. There's like four and then 8 and 16 and 64. Basically, the village becomes super organized and they've got like these rescue boats and this elaborate rescue system. And they're so good at rescuing these bodies or people off the river. And the village elders are praising the village, like, you are doing such an amazing job and all this stuff. And when I heard this, I was like, this is Western oncology. We're basically like glorified rescue workers, like pulling people off the river. And the question is like, what's happening up the river, right? So that's where I'm going now, is like to teach people how to get yourself healthy so you don't end up in the river and I have to pull you out. But then once we get them out, we weren't teaching them. This is what was so frustrating me with my so frustrating for me with my practice, is that I would get them on dry land, but then I couldn't tell them why they got it and how to stay out of the river in the future. And so now a lot of what I do is, okay, people get out of the river, okay, they get their, treatment, whatever that is, but then it's like, okay, let's teach you how to stay on dry land or how to swim in waters that are clean and not get yourself, down this river that is dangerous and basically making us sick.
Wow, yeah. Well, you wear so many hats. You are obviously a speaker, you're a conscious oncologist, you're a podcaster, so many things. I want to talk just a little bit about the support that you bring as being the host of the Born to Heal podcast, because that's a great resource for the listeners here as well to jump on over and dive into a lot of your content there. What's one mind-blowing topic or story that you covered and you left thinking, "Wow, this is game-changing?"
Yeah, well, actually, I just relaunched the podcast. Initially, I had launched it in 2020, I think, or maybe 2021. But basically, I was sharing like little snippets, short form episodes, like 20 to or 15 to 20 minutes of like how to make going through cancer easier. And then I stopped when I stopped practicing, and I just relaunched actually on February 13th. And the new season is me sharing my story of why I left Western medicine, what it was like to actually move through that transition. Because it's one thing to decide you're not going to do something, it's another to like really walk through it and get yourself to the other side. But then I've had expert guests in these different areas, and my goal with the podcast is to bring people on my learning journey. Like, I'm a student again, and I'm learning so much that I want to bring people along with that. And so my first few guests have been just fascinating. So I have Gerald Pollack talking about the fourth phase of water, also Thomas Seyfried that we just talked about with the metabolic cancer is a metabolic disease. But the one that was so like mind blowing for me, I just did with Lauren Lockman. And Lauren Lockman, he runs the largest water fasting facility on the planet and has water fasted over 10,000 people. And basically, the idea of fasting for 21, 30, 42 days with nothing but water, like nothing, no electrolytes, nothing, just water, blew my mind. So that episode, I think, comes out on like March 5th, maybe. But basically, that one is like, just mind blowing because I was like, who does that? Like 30 days with no food, like just water. But he has so much experience doing that. I learned so much from that episode. So I think that's one that's fascinating for me.
The link for that podcast will be down in the show notes, so definitely head on down there and check out some of those episodes or all of those episodes. Dr. Katie, this has been such a fascinating conversation, and you've really opened up diving into so many wisdoms and ahas. I know, at least for myself, I'm sure the listeners are probably having heads spinning right now and can't wait to get their hands on more. Can you tell us where people can find you, what's going on in your business, and how people can get into your circle?
Sure. So my website is katiedeming.com, and I do have a free workshop on there where I describe your roadmap to radiant health and the pillars for creating optimal health and basically cleaning your waters. So that's on my website. And that's free. And then I have the podcast, which is Born to Heal with Dr. Katie Deming. And I see people, I do group programs, but I also see people one on one. And in the one on ones, I do multiple different things. I do treatment decision consultation. So people who are looking at having conventional treatment and they just need another person to help them filter the information and understand really what are the risks and benefits so that they can make the best decision for their body based on their values. So I do that. I also do like root cause consults to help people get at the underlying issues that need to be healed to heal their disease, or people who want to get better results with conventional treatment. So you can find all of that on my website. And yeah, it's been a pleasure to be with you. So thank you so much for having me.
You're welcome. All of those links as well will be down in the show notes. Are there any last words that you want to lay on the hearts of the listeners before we sign off for today?
I think the one thing that is become like a mantra for me is that your intuition, when you know something is off, is often not going to make sense in today's society. So when you have those little inklings of something that you know needs to change in your life and it makes no sense in the external world, that is the way it's meant to happen. Because what's going on in the external world is not actually what's best for you. And so when you have that sense, don't take that because it doesn't make sense that it's not the right thing to do. I really encourage people to listen to that little inner voice because I've just seen so many people get to the end of their life and then regret that they didn't listen.
So beautifully said. Thank you so much, Dr. Katie, for being here and for sharing all of your wisdom and your heart.
Thank you for having me.